We're taking a video recording of the assessment chart, neurological observation. Okay, candidate, are you ready?
Yes, I'm ready.
Okay, you have 18 minutes for this assessment.
All right.
All right, you're on the ward nurse. Your timer will start now.
As I enter, I will check the environment for safety. I will provide privacy by withdrawing the curtain. I will do the hand hygiene according to whose guideline, pump to dorsal, interlace, interlock, tips, thumb, wrist. Hello, my name is Rose and I'm the nurse looking after you today. How are you?
Hello, I'm okay.
Oh, that's good. All right, I came here because I need to do your assessment and vital observation. Is that all right?
All right.
Yeah, I would like...
Where's
Yes.
Marla?
Oh, who is Marla?
Marla is my cat.
Oh, yeah. Oh, you have a cat. How many cats do you have?
I have Marla 1, Marla 2. There's 3 of them.
I understand that Marla is really dear to you.
Yeah.
Yeah. Do you know where are you?
Yeah, this is my room.
Oh,
At
I'm
home.
sorry. I think you have some confusion. I just want to orient you that this is a hospital and
Oh,
this is a
really?
Wexham Park Hospital. Yes.
Oh.
You were brought here by your doctor because you have a severe headache.
Okay.
Yeah. Okay. So I am a nurse. So I'm doing an assessment. Is that all right?
All right.
Yeah. Can I check with you your full name, date of birth,
Yeah.
and any drug allergy as I cross-check your wristband? Is that all right? Yeah.
My name is
Yes.
Joan Carey.
All right.
And then what else do you need, nurse?
Okay. Date of birth.
It's 2nd of July 51.
All right. That's fine. Your date of birth here is written 29 of June 1963. Can you remember now?
No, not really.
Oh, that's fine. Your hospital number is 897654. Do you have any allergies?
Oh, I'm allergic to paracetamol.
Okay, it's fine. It's written here that you're allergic to codeine. Can you
Oh,
remember
yeah.
now?
Yeah.
Yeah, and what kind of reaction do you have if you're allergic to codeine?
I don't know, nurse.
All right, it's all right. It's written here as
I'm
anaphylaxis
confused.
and rashes. Okay?
Okay.
Okay, thank you so much. So, assessor, as I can see that my patient's airway is clear. There's no signs of obstruction. As even though she's confused, she was able to answer all of my questions.
Proceed.
So, breathing. John, I'd like to do your pulse rate, if that's okay with you.
Alright.
Yeah. Do you have any preference of your arm?
I don't know.
Okay. Yeah, thank you so much. Assessor, in breathing, I need to assess for the respiration rate. But since the patient needs to be unaware, I need to do my pulse rate as well. Is that all right? Yeah. Okay. So, my time starts now. Okay. As confirmed with my assessor, my 2 minutes is up. Okay, Miss Assessor, the respiratory rate is actually regular. I don't see any signs of respiratory distress as the patient did not use any accessory muscle. I didn't see also sweating or any cyanosis from the patient. And it's actually 20 beats per minute. And my pulse rates, even though my pulse rate is under the circulation, it's actually regular as well. It's a strong, okay, and it's palpable, okay. So I need to write quickly. Okay. Pulse rate is 722 beats per minute, Miss Assessor. All right, John.
Hello.
Thank you for your participation.
Are you going home?
No, not yet.
Oh,
I'm not yet
sorry.
done. Now I'm going to do your oxygen saturation level.
Okay.
Is that all right? Yeah.
Alright.
Do you have any preference of your fingers?
I don't know.
Okay. Is it all right to use this left hand? Okay, thank you so much. Okay, Miss Assessor, I'm going to use this left finger. Before I will put the oxygen saturation, I need to check for the capillary refill. So as I can see that the index is intact, there is no precaution, there is no wound, so I'm happy to use. So I will press. Miss Assessor, the capillary refill is less than 2 seconds. So I'm happy to connect the oxygen pulse oximeter. Thank you. Alright, John, I'm happy that your oxygen saturation is 98%. That's perfect. Alright. Thank you so much. So now, John, I'm going to take your blood pressure. Is that alright?
That's okay.
Yeah. So I will choose the correct size. 2 to 3 fingers above the antecubital fossa. Do you have any preference, Harm? Sorry?
No, I'm
okay.
okay.
Good. Thank you so much. Make sure it's not tightened.
What are you checking again now?
I'm checking your blood pressure.
Okay, sorry.
So you will feel a bit pressure when I actually start, okay? But it will be for a short period of time, alright?
Okay, nice.
Just relax your arm.
Oh, it is inflating.
Yeah, sorry about that. Alright, while waiting that, Miss Assessor, I know that temperature is under the exposure. Is it alright that I will check the temperature now?
Proceed.
Yeah? Thank you, John. Oh, your blood pressure, that would be perfect. 109/73 is normal.
So why am I having headache, nurse?
Yeah, I understand. This is your primary complaint upon your arrival. Don't worry. I'm going to inform the doctor about that. Are you comfortable with your position at the moment?
I want to sit down.
Oh, I'm sorry. I wish I can do that, but because you're having a pain on your head, I cannot do maximum of 30 angle position.
Okay.
So, just to assure you, can you just do a deep breath exercises? Just mention that you have a pain, is it?
Yeah.
How bad is the pain from 0 to 10? 0 is no pain.
It's really
10 will be the
bad.
highest.
Probably it's 8, nurse.
Oh, I'm sorry to hear that. Rest assured that after this, I will give you a painkiller. Is that alright?
Okay,
Yeah.
nurse.
So I'm going to check your tympanic temperature now. You have any preference of your ear?
No, you can use the left ear again.
Okay. Miss Assessor, the ear is actually clean. No discharges, no wound, no redness, no swelling. I'm happy to use. You will hear a beep sound only, okay?
Okay, nurse.
Okay, you have no fever. We got 37.0 temperature. I'm happy for that. Alright, Joe. I'm not yet done. Would you mind if I do my neuro observation? Yeah.
What's that one?
Actually, I need to check your eyes. You have to look up the ceiling. As I check that one, I need to light up your eyes. Is that alright?
Okay.
Yeah. So, from outer to inner. Outer to inner. Okay. As I can confirm, Miss Assessor, that my pupillary reaction is on the right is 3+, on the left is 2+.
Okay.
Okay, under the disability assessor, I need to check my patient consciousness as my patient is obviously confused, and I need to do whether it is alert actually, voice, pain, and unresponsive. But my patient is actually alert. And plus, I need to do my intake and output. I will check with the record and I will monitor the patient. I will also need to check the blood sugar of my patient. For the exposure, John, can I actually continue? Yes. Can you help me to raise your both hands as I put pressure? And can you just control the pressure? Is that all right? Can you do it now? Okay. All right. Thank you so much. That would be lovely. And then I'd like you to raise your right leg And I put some pressure. Okay, okay, thank you. All right, and how about the left leg? Okay, that would be lovely. All right, thank you so much. Okay, Miss Assessor, I can confirm that both arms are normal power, and then both legs are up. The right is actually normal power, but the right one is actually a bit of weakness.
Okay.
So, Miss Assessor, for my exposure, the temperature is actually normal. By right, Miss Assessor, I need to expose my patient in order to see the skin condition from head to toe. So I need to check for rashes, injuries. I need to check for any trauma, any visible of broken skin.
Okay.
All right. So, John, is it all right that I'm going to plot your vital signs? Okay. Is that okay? Yeah. Thank you. If you need anything, you just interrupt me. Okay. Thank you. Can you confirm, Miss Assessor, the time?
Time is 1300 hours.
Thank you.
Candidate, you have 5 minutes left.
Miss Assessor?
Yes.
I would like to inform you that since the pulse rate is actually falls in there,
Yeah.
okay, so you might be confused that my blood pressure is 109/73.
Yeah.
Yeah, so can I put my pulse rate in there?
Yes, that's
Yeah?
fine. Proceed.
Thank you. Alright, blood pressure, pulse rate, temperature, oxygen saturation. Okay. Alright, Miss Assessor, my total Glasgow coma scale is actually 14, and I'd like to monitor my patient every 15 minutes since my patient is confused until my patient is stable.
Okay.
I'd like to inform also the clinical doctor so that they can assess the patient right away.
All right.
Yeah. Okay, Marla, sorry. Thank you so much for waiting for me.
I'm not Marla.
Oh, sorry. Juan, yeah. Thank you for waiting for me. Actually, your I would like to ask a few more questions, if that's all right.
Okay.
Yeah. I understand that you're actually living alone at home, right?
Yes.
Yeah, with your cat. So, okay.
Yeah.
Marla, sorry. The cat is Marla. So, how are you coping with your mobility? Can you tell me about that?
Oh, not well, nurse.
All right, I see. Okay, since my patient is actually having severe headache and they're suspecting subdural hemorrhage, Assessor, I'm going to refer this patient to physiotherapists in order to check the patient's mobility. And then, Marla, how about your eating habits? Can you tell me whether you're eating well?
Not really good, nurse, but I've been drinking a lot, so...
I see. Okay,
like
thank you.
drinking
It's
beer.
all right. So regarding the eating habits of my patient, probably I'm going to refer the patient to a dietitian if patient is allowed to eat and drink after the assessment of the doctor so that they can provide some supplement or food preferences of the patient. How about your sleeping pattern? Did you sleep last night?
I can't remember, nurse.
Oh,
honestly.
yeah, that's fine. And in this case, since my patient is confused, I will actually ring the next of kin or the main spokesperson to know more better about the patient or about Joanne Carey. So,
1 minute.
do you have any more questions for me? Okay. Regarding your, because since you're, yeah, Joanne, sorry, regarding your living condition, since you're living alone, I would like to refer you to a social service, okay, if that's all right with you, because you may,
30
yeah,
seconds,
you may not
nurse.
cope so that they can give you a package of care. Okay? Some carer will go to your house after the assessment of the social service.
Okay. Nice.
And when you discharge, all right?
Okay.
Okay, thank you. And do you have any questions? Rest assured that I'm going to inform the doctor for your pain. Is that okay?
That's okay, nurse. I'm
Okay.
for now.
All right.
Time's up.